Hi, I'm Dr. Howard Zucker, the doc in Docology. Each year in America, more than 300,000 women are diagnosed with breast cancer. Survival rates have improved thanks to early detection and medical advances. But not everyone benefits equally due to racial and economic disparities. Progress depends on research. And when you think of breast cancer research in America, one name stands above the rest: Komen. Since its founding in 1982, the Susan G. Komen Foundation has invested billions of dollars into research and community health. But none of this would exist without a promise made by a woman from Peoria, Illinois. Nancy Brinker, a Peoria native, made a vow to her sister Susan, who died at age 36 of breast cancer, to do everything in her power to end the disease. And that promise sparked a global movement. Nancy is a force of nature, driven, compassionate, relentless. She has served as U.S. ambassador to Hungary and recipient of the Presidential Medal of Freedom. And today she continues that mission through her creation of the Promise Fund, which has already helped nearly 70,000 women in South Florida receive access to care for breast cancer and cervical cancer. And that brings me to a well-known phrase, originally from the 1920s vaudeville era: will it play in Peoria? It was once, and probably still is, the test of whether a show or an idea, a product, has broad appeal across America. What they did not know then was that a woman from that city would one day create an idea, a movement that would play across this nation and echo around the world. So from Peoria to the world stage, Nancy Brinker's life is proof that one promise made in love and carried out with purpose can truly improve humankind. And she is my dear friend and our guest today, Ambassador Nancy Brinker. It's so good to have you here today.
Thank you, Howard. I love that introduction. I may have to can that and use it everywhere. I think that I have some colleagues with me today, and they're just sitting there rolling their eyes. It's like, don't build her up anymore. You know.
Well, thank you. You've changed the world. I mean, it's been a while since we had a chance to sit down and speak in person, but you have really changed the world. And very few people can say that. I mean, when
you have to have a little bit of confidence and somebody approving of you. And my mother was always that person. God love her, and may she rest in peace, but used to tell me all the things she really was a tough one when it came to will it work. And when I started Susan Komen, she was concerned. She said, are you going to be able to talk about breast cancer the way that the whole breast thing is not even allowed on TV? And I said, well, I hope so. She said, well, if you can, it'll go a long way, because there are a lot of women that won't talk about it. So
how did it be? I mean, breast cancer now, it's amazing. From 1975 to 2019, has been a 58% reduction in breast cancer mortality. So you've taken this issue on. How did it all begin? Share with us how sort of the whole Komen Foundation began, because it's really amazing. It's world changing.
Well, I was lucky that I was living in Texas, where all things can happen, good and bad. But I was married to a very supportive man named Norman Brinker, who passed some years ago, who was an entrepreneur himself. And then my sister, Susie, was so loving and darling. And when right before she died, and I used to go see her because they were living in Peoria, and she looked at me and she said, Nanny, this isn't right. You've got to promise me that you'll find a cure for this disease. It's just awful. It's not fair. And it wasn't just about her she was speaking about. She was speaking about all the other women she saw. You know, we had gotten her to MD Anderson to be treated in Texas from Peoria. That wasn't easy going there for all. But the fact was that she understood how important the fear was and how important it was. She also saw many, many other people, women of color, women who had no treatment, and watched them die because they had no intervention. So it just got into my heart. And when I promised, she was my older sister, and I always had to follow her. So whatever she asked me to do, I tried to do. And I said, I could see the sadness in her eyes. And I said, I promise you that I will spend the rest of my life, if I have to, finding a cure for this disease and making sure that people have access to the care. So that's what I'm doing now, Howard. I'm moved from daily working at Susan G. Komen to now the Promise Fund, where we are making it possible for women who are of low resource. They may have some insurance, but they don't have a doctor. It's so expensive today to have a doctor, if God forbid you have something, find the care and be able to afford it if you don't have great insurance. So that's what we're doing. And the town I live in now, Palm Beach County, has probably over 100,000 women who have very little health care, if any. And many of them are women of color. And when I saw this over and over, I just said, I can't stand this anymore. We have to do something. So we created the Promise Fund. And what we do is raise money. We were very lucky along the way. We're very fortunate to have access to one of the best federally qualified healthcare centers in the country. We have a wonderful one here. And I just walked in one day and asked them if they could give me some space and I would do everything I could to get a mammogram machine. And they said, okay. And I was thrilled. So then we went out, we got the equipment from Hologic, great company. And we started building the program, and everybody saw the same thing. You cannot have people die because they didn't have access to a screening. We cannot. We have an obligation as Americans to make sure our healthcare system is working for everyone.
And Palm Beach County is actually a very wealthy county. So this disparities between those who have and those who do not have is striking.
Howard, it's a White House town. It's a White House town now. We have a president living here. And I said, over my dead body, are we going to have a president living in a town where we're not able to do the right thing? So everybody's been supportive of us. And I would like to have it all done by now and set up, but we're working hard at it. We now have, how many centers do we have now? We have 4 centers, really programs where we have, where we've done with a federally qualified center. They're building another of their units in a different part of Palm Beach County, but we are becoming well known. We're trying to get on every billboard. We're trying to overdo it and over direct mail people and everything else. So it's working. And so far, we've screened almost, how many? 40,000 women we've screened so far out of a huge population. And found very little disease, by the way. That's the good news. And
that is the good news, yeah.
Yeah, and what disease we found, Howard, was early. And we were able to eradicate the disease. And then she comes back. She feels good now. She knows who her navigators are. It's been a godsend.
I want to uncouple some of the things you said, because you said a lot of things. One about the navigators in a second, but you mentioned it's a White House town. And so I do want to touch on that, because you wrote an article in the Sun Sentinel about Medicaid. And a lot of the individuals that you're helping need Medicaid, and there's a concern that could be cut back. So can you share a little bit about what you mentioned in that op-ed, and also where we should go about that issue?
We need Medicaid badly. We never should shrink it. It's having now dwelled for over almost 50 years in healthcare communities and in patient-based communities where you see the needs and the difficulty. For no other reason. It's not just about the care and the doctor, it's the fear. And the more we allow fear to determine people's lifespans is really scary. We shouldn't be afraid in our country. We have the greatest country in the world. And for heaven's sakes, if we can't make people feel that their community that they participate to, they pay taxes, because we're really focusing on the working poor, the people who don't have great insurance and everything. Well, then what in the world are we doing? Sitting around here and they're being denied some of the basic screening that could save their life? That just didn't seem right to me and to a lot of other people. Medicaid is a very good system, and I hope to God that we don't cut it too much, because so many people depend on it today.
And it is the community. You mentioned about community, and so in a lot of ways, what is happening? What do you think is creating some of the fear? What do you think is creating some of the challenges in society right now, where we're not doing enough as a community? And how do we change that?
Howard, you are so right. it bothers me because growing up in a community, we were involved in everything. My mother made sure if it was, my parents scraped at the time their paycheck, my father's paycheck, and bought all the inoculations for the kids to have the polio shot in the basement of our. Today we don't take responsibility, direct responsibility for our communities. We don't. And maybe it's some of my religious background, maybe it's some of just watching my mother, who was amazing. She was big leader of the Girl Scouts, and my dad was very philanthropic. And I thought, how do you live if your neighbors are having trouble? And mother used to say, if your neighbor's having trouble, go over there and fix it with them. Don't ask, just do it. So I was raised that way. We need to raise our children that way, and I don't feel sometimes like that's happening. I have to tell you, I think kids get off the wrong start. There's a lot of joy in helping people,
Yes, get a lot of satisfaction when you make people better, and what you've done is an amazing job in helping so many people around the globe on that. But if it is it's Palm Beach County, and there are neighbors. You could basically go knocking on their door, and some of those individuals say, "Hey, help us out here," whether it's on a policy level or whether it's on just a pragmatic care level, right? And so that's one of the challenges that I guess we're facing, and get more information out there. The navigators. Oh, sorry. Go ahead. Yes.
And that's what we're doing. My concern is, and we get cited in the little newspaper columns, but thank you for offering this because it needs to be a story that people hear. I'm a real human being. I'm not a billionaire, but I'm very lucky to have what I have. I've worked hard all my life. I was very lucky in many ways. And what is it to be able to say to people, come and join something where you have direct roll up your sleeves with your community? You'll be amazed at what happens, because that's how you get leaders. People remember that, So,
well, that's what you've done, leadership, and that's what you've done, leading in so many different areas. You mentioned about the navigators because you said you had when we spoke, you had about 15, right? But you've already reached 60,000 people or so with 15 navigators, 60, 70,000 people. So what you could do with like 150 navigators is just amazing. And how do you build that? Do you go to the state government? Who do you go to help make that happen? Tell us a little bit about what you're doing. How are you doing that?
I didn't mean to cut you off. We go to everyone. We go to our governor. We just went to our president last week with our new CEO, and she got right in the office and told him about the Promise Fund. We then went to, and we go to whatever people we know who can pull levers and make things happen. Unfortunately, in our county, we tend to have for-profit hospitals. Our county hospital is not reachable by everyone. It's way out in the glades. So we have some issues there. So we borrow other people's hospitals. We've so far only had 429 tiny cases of breast cancer or suspicious. And every single one of them has been taken care of out of that a massive amount. 229. I'm sorry. We're watching 429 altogether. 229 women had very minor disease, and we were able to ablate it very early. And now, guess what? They feel confident coming back with their getting in touch with their navigator and saying it, the navigator gets in touch with them. And so that's what we hope. And we're opening 2 more, as I said, 3 more centers this coming summer, and we're really looking forward to it in the county. Palm Beach County is one of the largest counties, if not the largest, in Florida. So we believe everywhere is our territory.
I have to ask, what did the governor and what did the president say when you went to them?
Well, I didn't go to see the president because I've asked so many favors of so many people over the years. I thought it was going to be much more, and I think it was much more effective to send our CEO, who's just brilliant herself, and she's very, how do I say it? She's really a woman who knows how to be to make someone understand what we're doing. And she did a great job. And then we went to everybody we could, heads of businesses here, friends of ours who we knew were interested in healthcare. And we went to a lot of different people, And then our partner, one of our partners, important corporate partners, and that's everything, is the Miss America group. Miss America, my friend, she bought it, the whole thing, the whole pageant, a couple of years ago. And now we have their organization. And you know what? You have to be in organizations that are willing to talk about you, where most people fear you. You need to make a connection to the community. They say, Miss America, well, gosh, I thought they were concerned with how people looked. No, they're also now compared with how people feel and how they succeed. So corporate partnerships mean everything.
So, I mean, partnerships, public partnerships, private partnerships. So
Right.
you had mentioned the federal qualified health centers, and
Right.
they're around the country.
They are.
How do you scale up for Florida, scale up for the country to get a partnership with more FQHCs?
Well, first of all, we have one of the really good federally qualified healthcare centers. Most people don't know about this system. It was Lyndon Johnson who put this system into play so many years ago. And it is the only real healthcare system we have in the United States geared to those who cannot afford, generally, again, working poor, middle class, but people who don't have access to care. And they're not all alike. We have about 1,400 of them around the country. But this one, the day I walked in and I saw an environment where the people were helpful, they wanted to be more important in the community. And so they're, I think, very delighted with our work. We've created some change around there, as you can imagine. But we are so grateful to have them as partners. So we're going to be doing a lot of looking. First of all, it requires, to do what we did, an on-fire volunteer, somebody who says, this is a good idea, we need to make it happen in our community. Now, I know a lot of those people from all their work over the years and all of our work in Susan G. Komen. And I've met so many wonderful people around the world who still want to keep up their work. And so I'm very excited, and we are excited about replicating this because it works.
So the message has to get out there. Lyndon Johnson was also Medicare and Medicaid. He started that, and from Texas. So another good thing that came out of Texas, as you were talking about before. You mentioned that you're going to do a screening. You mentioned me, you're doing an all-county screening day. Tell us a little bit about that and how that's going to move forward.
Well, what is really exciting is that I stole this idea. I read it somewhere. I'm so sorry. I'm just getting over a bad cold. But I read it somewhere in a magazine about how someone had done an event like this, but it wasn't screening. It was just an all-county medical day. And I thought to myself, we now have Palm Beach and West Palm Beach. West Palm Beach is a burgeoning, huge town. And yet we have this problem everywhere. And I thought, you know what? Now that they've seen that the Promise Fund has been successful, now that we can reach out, we need to include everyone in our county. So therefore, we're going to put a charge out that on a day we pick in October, because that's Breast Cancer Awareness Month. We help do that at Komen, make that a day. We're going to ask people and tell people that they can come and register, or they can make an appointment with a doctor that day who they've already gotten in touch with, and to make the pledge that every year they will get their mammogram if they're the right age and the right. It's September 27th is the day we're doing it. And we're going to light up the community with a lot of this, and we're going to get some criticism. I always get criticized, and I realize that's good because it's reaching somebody. You know,
people are hearing you. That's right. That's exactly right. You mentioned light up the community, so I thought I'd bounce back to something else that you've done, because we met when you were the U.S. ambassador to Hungary, and I remember that when I came out to Budapest, and you lit up the chain bridge, right? And so you increased the amount of public awareness to this, and this is in a country that was sort of a post-communist country, and so that was a challenge. And I was wondering, maybe you could talk about it, because now the breast cancer screening programs in Hungary have increased the amount of screening from 7% all the way up to, I think it was about 50%. Can you tell us a little bit about the cultural challenges and how you overcame that, to get the government there to move forward on that?
Yeah. And I think I remember telling you it was a subject then in those days. And that was about what, 15 or 17 years ago. 20 years ago now. And just going in, I had to find out who was the health secretary secretary, the equivalent of what we have. So I went to talk to, at the time, it was a man, but transferring, I think, to a woman. And he had a lot of good deputies. And I just sat down and told him the story. And I said, listen, why do you even want to have this problem in Hungary? You have a reasonable population. You could educate a lot of people. You could take care of most of the cancer in the country if you got people screened. And then they have several little towns, of course, going north in the country. So we visited some of the hospitals in some of their provinces and focused on a few of them. Would they accept these patients? So we walked over the chain bridge, the big bridge, at night with our candles lit. Naturally, it rained. And so that was my sister letting me know she was there. And we it was amazing. And for many years, they had this program. Unfortunately, the leader of it, the country leader of it, passed away last year. So they are reorganizing. I'd like to go back over there again to help them reorganize, because it's not always easy to reorganize these things unless they're very acculturated in the country. But it worked, and it was adopted by other countries. So the more work we can do, the better.
And so it is amazing, because some of the countries, you started with Hungary, but you're right, much of Europe now has focused on these issues, and you get a lot of momentum. You overcome a lot of the inertia. The issue you touched on this a little bit before, and at the beginning, I wanted to touch on it again, is the fact that cancer, back when you started the Komen Foundation, cancer was not a word that people spoke about regularly, and it was whispered, right? It was hidden. And so how does one break such a cultural silence at that time, back when you started Komen, and overcome some of those obstacles and the inertia to move that forward?
Well, fortunately, today, breast cancer is probably one of the most known cancers for women, which has been done over the last 40 or 50 years. But at the end of the day, you have to dive in and know there's going to be some unpleasant things. For example, you can't find care for a patient, maybe, or somebody got rejected. Those are the issues that are the most difficult to deal with. And if there's not a county hospital in the town or in the region, it gets harder. And that's why we have done this program and are pushing so hard for the FQHCs to develop these screening issues and programs, because they function so well. So that's really, and then also it's not scaring people. A lot of people still have a funny stigma against getting on TV and talking about breasts or whatever. And but that stigma is kind of getting over with. I mean, people know this is a deadly disease. And actually, not too far behind is cervical cancer now, which is also what we approach in our clinics that we have in the FQHC, because we really want people to know that these diseases can be dealt with early on. And that's the important thing, to know they're there, to make sure you're diagnosed, or at least undertaken all the prevention you can.
And we've made great progress. I mean, there are new drugs out there. There's new therapies, and some of the therapies a little bit of a challenge, because some of the new CAR T therapies a little bit more challenging for breast cancer. But we'll get there, because it's amazing how far we've come.
Right.
I wanted to ask you a little bit about one of the key questions. Sorry, is first of all, 3 takeaways. Like, what are some of the things you think we should remember about what you're doing, the Promise Fund, and in general about breast cancer research?
So, health is a responsibility for all of us. We are all citizens. I mean, maybe there's a lot of people listening who are not citizens, but we are citizens. We have sort of committed to our country the idea that this belongs to all of us. Therefore, that includes the healthcare system. We need to be the best citizens we can about our healthcare system, that which is operating in the local community, the state community, the national community. All of it's important for you to know, because particularly if you have children anyway, you're going to want to know what's where, what hospital is where, what can I learn? How can I get a woman a mammogram? Where is it? Because there are programs. Sometimes you have to do a little work to find out. And so we have an obligation as Americans to take care of our country. Our healthcare system is one of the most important things that we can deal with and should and should persuade to do certain things if we know we're doing the right thing and have a group of people with us who know we're doing the right thing. And also, I always think, Howard, you got to make your life useful. Don't be afraid to step out and do something that seems impossible. It may be, but you know what? You'll feel better working on an impossible thing and make progress than doing nothing. And this has been the greatest joy of my life. And I was very lucky to have a mother who constantly, if she wasn't running the Girl Scouts, she was over at the hospital. And from the time I was 6, she had me sitting by patients' rooms because they didn't have communication systems then when I was young. So do things for your children or challenge your children to do things. Even if you want to be one of those little white lady people that go around the hospital and hand out snacks or whatever, volunteer when you can. You'll learn so much. Join the Girl Scouts or the Boy Scouts. Join, talk to your local hospital. What can we do to help you? And then I think applying what we know. It is very important that once we've invested in something in this country and we find out what the pros and cons are, that we keep our politicians on track. Apply what we know, and what we don't know or find out doesn't work, mostly what doesn't work, get rid of it or send it someplace else or combine it with something else. And people aren't imaginative enough about our government. They're constantly criticizing it. Well, then use some entrepreneurship to figure out how you can do something. And that's really what we've done with the Promise Fund. Step by step, we've taken on the places where we know we could have impact, and we're growing where we want to have impact, and we're saving our money. We're working much more, we're much better at spending our money than at any time I can ever remember any charity I was a part of. So given current and historic information, applying what you know is important. And we know what we have to do here. And it would have been and then think about your lifespan. This is kind of crazy. I'm just so lucky I've lived this long. But I've spent almost 50 years working on these issues. And then you got to say to yourself, well, what's left to be done? Maybe you are one of the only people that can do it. Or if worse comes to worse, people are afraid of you. So that's okay too. Or they don't want your phone call. You're a nudge, as my mother used to say. But they may not want to talk to you, and they may just say I've heard this happen, just do whatever she tells you to do because you won't go away. So be persistent. That's what Americans have always been, shown a great side of persistence. And remember my slogan, most of all, no means maybe. Okay, that's my top. Everybody else has these patriotic expressions. Mine always is just because someone says no, it could mean maybe. So always have hope. And then get a good night's sleep so you have lots of energy. Every amount of energy you will spend on helping someone's life is really important. And right now, I mean, women of color die twice as fast of breast cancer than any other. And it just makes me sad and sick. I'm not going to leave this world knowing I didn't try my best to get that changed. This is ridiculous and stupid and not fair.
And you're doing it. And I had in my notes, I said, no isn't in your vocabulary. So I actually put down this. I'm glad you raised that. Of all the people I've met in medicine and public health and public policy, you have been probably the most inspirational, or very few are that inspirational as you are. And I wonder what you would tell young people today with the way the world is struggling and all the turmoil and the complexities. How do they pursue their dreams? And I thought that would be a good thing to ask you, given what you have achieved.
Well, I think it goes, excuse me, the no maybe rule. First of all, I suspect, though I was never tested because we didn't do that then, is that I am very dyslexic, very much like my son is dyslexic. So I know now, watching him struggle, I had the same thing. But I got good grades because I was always able to get next to somebody who did know a lot more than I did. And I would say, what do you think the questions are going to be on the test? And they would tell me. And then I'd have to figure out how to answer it. But I really realized what an impact you can have if you just do something that maybe is unpopular, that other people say no to. People give in too easily. You can't give in to no. And you just have to move on. Thank you very much. I appreciate your time. Goodbye. See you later. We'll be back, and then go back. Don't ever leave somebody on the ground and don't go back. Because usually if you're that committed, I won't say you know you're right, but if you've done enough research and you believe in what you're doing, for God's sakes, don't let any American turn you down, ever. I mean, this is who we are. So that's it. And I got to tell you, it works, because so many people are discouraged in schools today. They're told what they can't do. You can't go to graduate school. I probably had the lowest score on the what is that test?
SAT?
Yeah,
SAT.
I'm sure I did, because they made my parents come back 3 times to measure me. And my dad said, you just aren't paying attention. You get in front of that test and you look at it and you think, what the hell do I need to know that for? That isn't the attitude, dear. But play to your interests. Don't ever let anybody tell you what you can't do, because everything we know can be fixed. So that's it. I just want the young people in America and the older people, if you're bored, if you're angry, do something for someone and you will feel better. You will be better.
Well, that is wonderful advice for students. I will tell you, about 15 years ago, I decided I was going to take the SATs again, just to see whether it actually made a difference, whether I learned anything. So I took the SAT books out and I started to look at them. And then I was just too embarrassed to say, I don't really actually want to see what my score is going to be 15 years ago versus way back when I took it in college. So that, I have to tell you that your sister would be incredibly proud of you for all that you've done. And perhaps in some way she already knows. You've lived up to that promise for the entire world. And the world is really grateful for what you've done. We've reached the point in our show when we turn to our most important guests, which are our subscribers out there. So we're going to tee up those questions.
Okay.
I always mention at this point about the podcast that it's for informational purposes. If you have a medical question, since we've been talking about a lot of different issues, you should always talk to your doctor, because they know your history. And if I'll just add this part, and if you don't have a specific doctor, there are clinics, there are places to go, so that you end up being able to get the care you need. So Kat, I'm going to turn it to you to bring on the guests that the subscribers that have questions for us.
Thank you, Dr. Howard. You're fantastic. And thank you for doing this podcast. This is very good.
Thank you. All right. So we have some questions. It'll be great.
Okay.
But I'm going to ask the first question. So you had talked a little bit about underrepresented communities and reaching out to them and making sure people sort of understand that they have a higher risk in some ways. And I was wondering how you found what's been the most effective way that you've been able to reach out to underrepresented communities for education and just in helping them getting screened as well.
First of all, thank you for that question, because a lot of people have asked me that. The first thing you have to do is acquire some friends. If you haven't had friends in these communities, shame on you. Go out and find these friends, and mostly, like everything else, if you're doing something and you look around the room, you're going to see people today of color. In our case, we have a large Black population. We also have a large Hispanic population, and everything else that I don't know. We don't look at the passports. We don't care. But the point is, you've got to reach out yourself. Nobody's going to come to you, because there's a certain fear, like they don't want to have anything to do with me. Yes, we do. And if we don't know person to person what the issues are, I don't care what you read, there's always something you learn when you go through a problem with a person who has lower resources, or who is of color and felt rejected, or anything, or social problems because they don't want to talk about a disease in front of their husband. I mean, all kinds of stuff. So I find that it's really up to you as a person. Don't complain. Don't tell me what you can't do. Tell me what you can do, and it will work. And that was my mother's philosophy. My mother was exactly like that. She had friends of every color, every religion. She'd go to their churches, and I do too. I have a really good friend, Mamie, and I go to her church. Her husband's head of the Baptist church. I get so inspired when I go there, but I know their culture better than I understand certain things. You can't serve people if you don't know what their hearts and souls are made up of, and what their values are, and what their deprivations are. So that's it. You got to get off your bum and just do it.
I really appreciate that. Thank you very much. And that's honestly, that's fantastic. I do think it serves you well to actually be in the community and experience that a little bit. I'm going to bring up Miss Eileen, who has a question. So let's go ahead and bring her up.
Thank you so much for doing this. This has been really informative, and thank you for being such an enthusiastic advocate, Nancy. I live in Canada, and I'm saying that not to sound smug in any way, but just to explain the context of my question, because some of the things that you've said are totally alien to me, and they make me simultaneously angry and very sad. Things like for-profit hospitals, things like women not being able to access the care that they need because their Medicaid might be cut. Those things are, it's bad enough to be afraid that you have cancer, to have found a lump, or to think you carry the BRCA gene, but also not to be able to access that care. But my main question is, and I hope that didn't sound smug, it wasn't meant to, but my main question is about gynecological cancers in general. Do you feel that the research is underfunded? Are those cancers not getting the attention that they deserve?
So I agree actually with everything you've said. I don't like for-profit hospitals. Believe me, I didn't say it to market it. It's not a good model. On the other hand, it depends. Every system is different, and some of them do have budgets where they, care for people, but that's not their main business. But the other thing was really about underfunding and Medicaid. Medicaid is such an important part of what we do, and so many Americans and of course, as Canadians are on this system. So I'm a complete Medicaid proponent, and I don't ever consider, unless someone's taking advantage of the system and spending, doing something mean so another patient can't get that service. I really, I also get angry at people who somehow wiggle their way around and push other people out of the room. So, it should be equalized, whatever they're doing. And I just hope that you understand in America, as you know, since our president wanted to gulp yours down, your country. And of course, many of us would love that, by the way. But seriously, I think that we just don't always have an ability to do everything we want to do here. And I do understand what you're saying. And so that's why we're trying to introduce concepts that should be taken into normal medical practices. That is prevention, early detection, early action. And a lot of the problems we're having would go away because you'd be able to treat people so much earlier. What didn't I answer? I'm sorry.
It was about whether gynecological cancers in general are underfunded.
Yes, they are. They definitely are. And, we don't know, for example, ovarian cancer is a deadly cancer. And I'm not sure we know soon enough whether a woman's really developing it. There are early screenings that they can do and tests, but we're not too far advanced in that. And Dr. Howard may know more about that than I do.
I mean, we need to do more research on that, and this goes back to a lot of the genetics as well, and also some of the new therapies that are out there. So that's a tough cancer, as both the period of time when one is diagnosed. I had one of my dear friends died of that, and Eileen and I are friends from college, and she knows the person because she used to live on her floor on the dorm. So we recognize the challenges there. So hopefully we'll be able to tackle that and take it on the same way we've taken on other issues, and have someone advocate like you have advocated for breast cancer. Well,
and as soon as we can convince even for-profit hospitals that they must embrace, kind of advocating for the doctors in their practice to make sure women have these tests, these early testings, if they go for a primary checkup, that they have the access to sometimes they don't offer a mammogram, even sort of a pathway to get one, or cervical inspections or whatever, but people have to be educated. And again, we have to go into the schools and say, well, I still like to use the example of the American Cancer Society. As far as I'm concerned, the best program they ever had. I don't know if you remember this, Howard, you may have been too young, but they told the kids in the primary schools, the little kids, how many of your parents smoke? And they all raised their hand. And they said, your parents are going to die of cancer. And those kids ran home and told their mother, you're going to die of cancer. And the smoking curve in America went like that. That's what caused fewer people smoking in America. Just that. So sometimes doing a public campaign is something that can be uncomfortable, but you have to do it. You need to do it.
We did that with the drugs, right? Remember the whole thing with the this is your brain on drugs, and that frying pan, and it was one of the most powerful advertisements in the United States at that time. Right.
And that's where the advocacy comes from, of course. And then they get their parents all upset about it, which is what they should do. And then they can lobby. They're congressmen, they're senators, they can go to Washington, they can lobby to their state, to any way they can, to any group they belong to. That's the beauty of our countries.
Kat, excellent. Thanks. Great question, Kat.
Thank you.
I'm going to bring up Anna. She has a question.
Hi, Nancy. Hi, Dr. Zucker.
Hi. How are you?
Very nice speaking with you. And Nancy, your work is absolutely incredible. I mean, I just think listening here on this podcast, how you've probably saved several of my friends' lives through your work. So thank you. Sorry, I'm getting emotional.
Thank you for saying that. So nice.
Yes, thank you.
I hope they're well.
Yes, I have two friends that have survived breast cancer. So thank you. I have two questions for you. They're kind of short and sweet. The first one is, does the Promise Fund have hopes to expand to other communities in other states? Yeah. I'm also a fellow Texan. I'm in Dallas now, so I know Peoria. Is that where you're from?
Yep.
That's amazing.
I lived in Dallas for 30 years.
Oh, that's awesome.
Yeah. Texas would be a great place to have a Promise Fund. Although, remember, their healthcare system is different there than, they have a lot of support with the wonderful county hospitals they have and the research centers in Houston, and it sort of radiates on the state. But any community that you see that is slightly underserved or more underserved, this is the Promise Fund is a model made for that. And even some of the bigger ones, because even if they're supported in their care, lower resource people who we call the working poor, it's time for us to take care of them in a big way. It's time for us to have them be able to go to a safe place or safe community place setting and learn about what they need to learn, because there's tremendous fear in their lives that they can't afford it, number one. Two, that they're going to die of it. Well, they will if they let it go on. And three, it's very important for us to do that in our country. And right now, the best way to do it is in community settings, because people in communities want to help. And so we've shifted a lot of all these people complaining down here about their taxes. We've shifted the idea that this is something that has to be added to your federal income tax. This is not something that a federal anything can take care of. This is something that we do as neighbors, as Americans in our community. And that's how to look at it. Don't ever not think that way.
Absolutely.
But I can say what I think. Don't, you're thinking just the right way. And we're on you go to promisefund.org. Do we say the now? I don't know. We have trouble with the. Okay. So the promisefund.org, and you'll see everything that we do and everything that we have done and everything we want to do. And don't be afraid to outreach to us. We would love to talk to you.
Sure. That sounds wonderful. Thank you. I have the website pulled up, and I guess other just, well, I say short question, but do you know if there's any new developments in cancer research that have you feeling optimistic or excited?
I'm gonna shift this to the doctor because there are many, many things that are. But the problem that I'm worrying about more than anything is accessibility that patients may or may not have. Because isn't it true, Howard? A lot of them are still in clinical trials. Or can you explain to her and to our guests how they how this works?
Sure. So there are some new drugs on the clinical trials. I was looking this up over the last few days, some in 2024, and there are always new ones coming up. But it goes back to a couple things. One is making sure you have the research funding, making sure that NIH continues to push forward on getting the monies out there, and also making sure that we don't have any challenges at NIH on that, and then also making sure that you enroll people into these trials. And this is a partnership between NIH. It's also a partnership with CDC, well, NIH and CDC, but also FDA needs to approve these drugs. So we've had some challenges, as you and I have spoken about, with the cutbacks. And when you have cutbacks, some of those things take time to get approved. So everything ties together. And then you've mentioned it about access to care, which is really, really important.
And exactly, and making sure that where, if you're going to do a community, which is there a not-for-profit hospital? Is there a clinic associated with a for-profit hospital that takes care in? And sometimes some of the big organizations have relationships with physicians, like we do. We're not that big yet, but we do. We have doctors who have agreed to volunteer their services, and that's not easy for them because we don't have tort reform in Florida. You can sue a doctor 20 times if you want. However, most people know that, and most doctors know that and get insurance, but it's so expensive for that, Howard. That is a real sadness about our healthcare system in Florida that I hope we can help educate people about. But anyway, you need to learn all that stuff ahead of time, and then you know who you can go to, who you should push a little. And what I think is interesting is that once somebody has a pleasant experience, and obviously you have, directing friends or people, you never give it up because you know you're helping someone. You don't have to pay money to help them. You don't have to, but you help them. And we're losing a little of that in our country.
It goes back to that community spirit issue that we were talking about. Right?
Yeah.
And then there's some big hospital systems that are going down to Florida as well. Right. And so maybe when they build those hospitals, there's a way to make sure part of their care is to the individuals that and all these people who you are helping, that get them into the clinics and make sure they get the care and the screening and then the care that they need.
Well, we've already visited with one of them, and we don't know whether they're coming here for sure or not. But the point, you're absolutely right. And I'm hoping that they will understand that when they come here, it's not just treating wealthy people. We have a very mixed community. We have a lot of people in need all over the place. And this is the thing I'm trying to get all my friends to understand. Nothing is universal. You have to watch it all the time. And you're absolutely right, Howard. And I hope any hospital who comes down here does not make the mistake of thinking it's not going to be just as challenging as hospitals in other, even major cities. So we're going to make it a little challenging. Oh, well, I shouldn't say that, but oh, well.
Anna, do you have other questions?
No, that was wonderful. Thank you for your time, Nancy, and for fighting for women and people who maybe don't feel like they have a voice. So thank you.
Thank you, Anna. It's nice to meet you.
Nice to meet you.
Thank you.
That was our last question, Dr. Z.
Okay.
Excellent. Well, Nancy, this has been a pleasure. You have shared with us how you've taken on breast cancer, which is an amazing challenge. You've never stopped pushing the world to improve the lives of women everywhere. You've done this here, overseas, and everything. And I believe that the Promise Fund will become the model in other counties across Florida, because you'll make sure that happens, and also across the nation. So I am confident that you'll do this. And I'm going to make a promise to you that I will come down there to visit and see firsthand your work on the front lines. So Absolutely. And I will say it all began in Peoria. So, and
Yeah.
your mom would be proud, your sister would be proud, your mom would be proud. Sorry, go ahead. Yeah.
No, it's so thank you for saying that, because I have two of my colleagues here today listening and trying to help me with my non-computer skills. But you just put it the way it is. And the more thank you for saying it, the more we can make people realize how we as Americans have the opportunity, the freedom, and everything else to make these things happen. And I appreciate you, of all people, saying it, because you've done your service in New York City. You are just an amazing health leader. And you know what? If we all just practice what we know, we'll keep our country out there, the most wonderful country anywhere. And I'm so proud of it. So thank you for having me. This was such a pleasure.
Thank you so much. And it's a pleasure to have you here. That's our show for today. Next time on Docology, my guest is Dr. David Kessler. He was the former commissioner of the FDA.
Wow.
And he just wrote a recent book called Diet, Drugs, and Dopamine, The New Science of Achieving a Healthy Weight. And so he's going to share with us how foods stimulate cravings and what leads to overeating, what leads to this widespread obesity we're seeing, and some strategies that we can use to break that cycle. So remember, if you are a Docology subscriber, you could join the show. Just click on the link in the bio and tune in next time, because the topic we cover may just save your life.
Absolutely. Wonderful, Howard. Please tell Dr. Kessler I said hello.
I sure will.
He was great.
I sure will. Absolutely. I will tell him that.
Thank you so much for having me. What an experience, and good luck, and God bless you.
You too. Thank you. Docology is a production of Hang Media. Our producer is Catherine Warren. Ronnie Selig is editorial advisor. Our creative director is Anna Richard. Janine Wilson of Wilson Media Group handles paid marketing. Our publicists are Leslie Ann Wade and Jerry Caracoli. Theme music was composed by Nick Kitts. Subscribe and join our community at docology.life. Until next time, move, wash your hands, and stay healthy.